What has changed the most about this area, I think, is the fact that we've grown tremendously in a variety of ways. We've grown in business and industry, we've grown in the social services sector. The diversity of our community has changed, and it's exciting to see all of those changes happen. For me, why do I stay here? I think I stay here because it's a safe community, it's a warm and welcoming community, it's a community in which I'm proud to raise my children. They can get a great education here and continue to get a great education and have a lot of opportunity here as well.
My name is Mike Altacruz. I'm the mental health coordinator for Neenah Joint School District. We had such a high amount of students who were experiencing mental health issues according to our youth risk behavior survey. I'm happy to say that we were able to go from double digits to students saying that they had actually made a suicide attempt in the last 12 months to only 4% of our students, which is still too high, but is about half what the state rate is, and 6% less than the national rate is. A lot of that has to do with a lot of the things that we've been doing here as a school, but also with our community partners like US2. US2 has come along and not only improved upon what our previous models were, they provide 18 days worth of services and serve every one of our schools.
I have had some of the best mental health assessments for my clients come out of US2 Behavioral Health. I've not seen anything more competent. Many of the resources that my people end up getting access to are things like grief counseling, which is not something that's typically considered a part of a treatment plan. So they're getting more comprehensive care, which will have more long-term results as far as being able to stabilize and recover. If I can never have to go to another provider for that, I would prefer to go to US2, hands down, if I get to pick every time.
US2 is creating a name for ourselves as being a leader in perinatal mental health in the state of Wisconsin. We developed a continuing education credit course on perinatal mental health, which we trained all of our staff in. So that was, I think, 18 people and 1 intern. And then we've also trained 173 professionals throughout the state of Wisconsin in best practices for caring for new and expectant parents. Not only are we impacting the parent, but when the parent is taking better care of themselves, they then can do a better job with parenting and caring for their little ones. And so really we see that the whole family system and really the whole community is healthier.
Genuinely, one of my favorite things about working at US2 Behavioral Healthcare is being a part of the DBT program. We wanted to be able to offer this very beneficial service to more clients to help serve our mission.
DBT stands for Dialectical Behavioral Therapy, and what that is it's a 6-month to a year intensive behavioral intervention for clients that have very severe emotional dysregulation. We've actually saved the county $1.2 million in hospitalization costs, which means that we have a lot less clients self-harming, going in for ER evaluations, taking ambulance, being put under evaluation in the ER, going in for an inpatient stay.
Right away, we can see the benefits of clients coming into the program, which is always very rewarding.
What our organization has known about US2 in terms of providing counseling services to individuals in the community, we have learned that they are doing so much more, and showing up in the community in order to meet unique needs and be supportive truly for any organization that can benefit. They are interested in supporting you at wherever you're starting from and really individualizing the approach to whatever your needs are and whatever your capacity is. Knowing that we have that flexibility because US2 understands how critically important it is for us to have diverse voices at the table and that our employees have a say in what we're doing.
So the impact that US2 Behavioral Health has had upon our organization has been great. We have been able to refine the policies of our organization to best align with where we want to go as an organization, but also best align with the needs of our community as a whole. It's kind of a hidden gem, quite honestly. I think as an organization, you provide services that are so critical to our community. US2 Behavioral Health has really helped to bring people together in a variety of ways.
That's part of their mission. They want to look for how to best be equitable. They want to look at ways to serve those who would otherwise not get served. And they also want to make sure that everybody's included.
They care very much about their business, about their employees, about the people that they serve, about getting to the core issues and not checking boxes.